And we're live.
Hello.
Okay, live on live on Instagram. Hello, everyone.
Hi, campus. Whitney's going for it in the background.
She is. She's on the warbler's going.
I can't stand
Alexa.
You've just
volume
set
down.
everyone's Alexas off now.
Oh no.
You
Oh, sorry everyone.
inconsiderate.
No, she doesn't do what I want whenever I
No,
ask
I know.
her, so maybe she'll do it with someone else.
I don't know what's going on with Heart at the moment. It's fairly shocking, isn't it?
I
It
just
is,
can't
isn't
bet
it?
any more George Ezra. I literally this morning
Oh,
I put
no,
my makeup
I
on
know.
and his bloody tigers, shotgun rubbish
Oh,
going on
I know.
again.
What's that
turned
on
I
up.
don't understand what his
I
songs
don't
mean.
understand it
He's
either.
just boring.
I know.
Anyway, happy Valentine's
Oh,
Day.
yeah, we've got
I quite
people.
liked
Hi.
him briefly because he's got a bit of a penchant for the older woman. I thought,
Oh,
Have you
quite a
seen
nice
it?
boy. No.
hi, Janie.
No.
Oh.
No, he's not. He's not nice. Don't even. So, hi, everyone.
Hello.
Hi everyone, happy Valentine's Day.
Happy
Oh,
Valentine's. So we're doing live demo of RF microneedling today.
And RF stands for
Radio frequency.
Radiofrequency Micro-needling. So I've already numbed
Hey, Sharon.
Ali.
Yeah, baby.
Sharon, Secret Garden. She,
Oh.
Hi, Sharon.
she loves our lunchtime heckle.
A heckle. Cackle.
Cackle.
So, this is
Love
Is
it.
indeed.
Love it.
it's Ali's programme,
Yes.
hackage
Yes.
programme,
Hackage.
My plan.
her master plan. So I thought I'd use her as my willing
Well, that's a bit close.
victim. I said last time. get
I
more
wasn't close
up.
enough last
So
time.
now
Yeah,
we're going to be like,
seeing as a certain surgeon who shall remain unknown.
no, she doesn't see my
It's
sessions, but that's
absolutely fine as it is. Thank you very much.
it's not that conservative. That'll mean nothing to most people.
To most, but to Sharon. Sharon will know.
So, what you may ask is radiofrequency microneedling.
Yes, what is it?
Yeah, what is
Well,
it?
that's
Pray
about
do tell.
well, I thought, otherwise we could waffle for an hour and not actually get any questions answered.
It's a little bit pinchy in some places,
Is
that's
it?
all I will
We
say.
haven't got to that question yet.
Okay.
We're not there yet.
So, it is like standard microneedling on speed.
We always say that. I love it.
So a lot of you will have heard of microneedling as a treatment because it's been around a long time. It ain't
Derma rollering, it used to be known
derma
as.
stamping. It ain't nothing new.
Derma.
And some of you also might have heard of radiofrequency as a standalone treatment because both of those are treatments in their own right.
Oh, I tell you what I've heard of.
What have you heard of?
Morpheus 8.
Oh, yeah.
Some of you may also have heard of Morpheus 8, which is just another form of radiofrequency microneedling, as is secret RF.
Oh, yeah,
there's
yeah,
a
that's
million
Yeah, there's
different-
lots.
There's loads. Essentially, it's the same thing.
Yeah.
But you'll be charged twice as much for Morpheus 8.
Yeah, I know.
Now, so in terms of what it actually is and what it does, and that I figured I can't really multitask and
That's
speak
all
and
right.
talk,
I'll have a little break.
but
Yeah.
no, that's
As long as the anaesthetic doesn't wear off.
well,
Oh my
that's why I'm
gosh,
trying
yeah.
to work quickly. So, what radiofrequency microneedling is great for is fine lines and wrinkles, skin texture, basically, pore size.
Pause. It's
loss
amazing.
of-
Pause.
Oh, I've got something in my left eyeball. Loss of elasticity. Alright.
Loss of
Loss of
sight.
elasticity. yeah. So when you have, so it's less, when we're doing things like HIFU, we're trying to lift areas like the lower face. Radiofrequency is working more on the surface tone and texture. So it's better for...
Oh my god, I just had a flashback to us going,
Lift.
Time.
Tight, I know. If you were with
Sorry,
us on that
interrupted.
journey, then
yes.
Yeah. Oh, it does what it says on the tin.
it does.
really.
It does.
Now, the way that it actually does its job, I'm going to have to get this thing out of my eye, but you're going to have to not
I
film
thought
me
she was
while I'm
going. I
doing
thought
that.
she was talking about me.
No, I think it's a bit of fluff.
Wait,
I got it.
Oh,
I
well
got
She's
it.
got it. She's good.
I got it. So, basically, the way that it works is it uses, as the name suggests, micro needles, tiny needles.
Yeah.
And this
Sure.
is how
Yeah. Do you want to show us? I can tap both screens, so
Can
we're
you?
good. See, I told you, I'm good.
Can you see that?
Oh, look at the little babies go.
Can you see them coming out?
Mama loves you.
Yeah, they look good.
I'm so glad I've got a mask on because my mouth is gaping right open right now. Concentration.
They're so cute. I love
Can you see them?
Yeah.
So in this case, there are 25 micro-needles.
25.
25. And in the case of normal, let me just finish a sentence. Honestly, it's just hopeless. Hopeless. I'm overheating.
Mother, daughter, mother.
I'm overheating. I'm not having the treatment. Right. So it uses a series of tiny needles, as does normal microneedling, and essentially we are creating lots of. Sorry, the top lip is more sensitive. Lots of little injuries in the skin, which triggers your body's healing response, and in doing well. As part of the healing process, it then produces collagen and elastin.
Yay!
Yay! Which is basically what we are starting to lack as we get older, and the more of it, the better.
Starting to lack. When you go into menopause, it drops off the side of the cliff.
Did you
So,
just shove the machine?
where was I?
That's one way to show up.
Starting to lack. You might start to lack in your 30s. At my age, it's dead and gone.
That ship has sailed, as I said the other day.
She did.
Now, that's what microneedling on its own will do. But
what does the RF do, Jade?
Thank you, Nathan.
You're welcome.
Sex is her.
The reason that this is like the next step up, microneedling on speed, is because of radiofrequency energy, which is delivered down each of the needles at the same time it enters the skin, as per our little demo here. So you can see that's lighting up. So the needles are not only entering the skin, making a little a mechanical injury, but at the same time, the radiofrequency energy is heating up the layers of your skin as well, basically giving you a double whammy of collagen stimulation.
Love that.
Yes.
That's what we need.
So it's just a better version of microneedling, essentially.
As we say, on speed.
Now, you are numbed for it because one of the questions we received is, does it hurt?
And Ian Little has just said, is it painful?
The short answer is yes, if you're not numbed.
Yeah.
Now, we have very, very effective anaesthetic cream, which we leave on for about 20 minutes to half an hour beforehand, which makes the whole experience very manageable. It's not to say that there aren't some areas like your top lip, poor Ali.
No, that was fine. It was my chin. I felt it a little bit.
Some areas are more sensitive than others, and top lip is quite a common one. But we can vary things like the needle depth, the amount of radiofrequency energy being delivered down the needles at the same time, and how long it's being delivered for are all things that we change, all according to different parts of the face that we're working on. Because areas like your under eye, for example, the skin is much, much thinner there, so it won't need as much energy or as deep a needle depth as, for example, your cheeks. So we tweak things, which ultimately makes it more comfortable.
Yes. We didn't say, but Jade did already start doing Ali. She's not just big, blotchy.
Interestingly.
Yeah, this isn't her normal skin.
Right, I'm coming around to the other side. So, what other questions have
So I've got another one. Does it work on the elderly?
On the elderly?
Yes, absolutely. I'm having it done.
You're not elderly.
There really is. There aren't many skin types that wouldn't benefit from this treatment because ultimately, like I mentioned earlier, it's just stimulating new collagen. So it's actually a really nice option if you don't fancy something injectable because it's not adding anything foreign into your body.
Yeah.
It is relying on your body's systems, if you like.
When you're talking about age, you're always going to make new collagen. It does slow down, and it does. You lose a slightly higher percentage per year than when you're younger, but you're always going to make it. So it's just kicking it up the bum, really, to remind it to keep renewing itself.
There's a tagline.
Yeah.
Booting your collagen up
Up
the
the
bum.
So definitely, yes, for older skins.
Yes, and when you've got those kind of, they're called glycation lines of the mid-face region, some skin boosters can get a beautiful result. Yeah, they can be tricky to treat, and you need more than one session. So, there's a question. How many treatments? Now, we say with radiofrequency microneedling, you need to aim for 4 to 6, okay? Because new collagen production takes a while to happen. Can I flip you over a bit? Thank you. I did not yank her head. That was dramatic. this time.
Hi, Sheikah.
Yeah, new collagen production.
And Karen Perry says, how many sessions?
Well, I was just saying,
Yeah.
Karen, 4 to 6 is a really good number to aim for, because we're stimulating collagen each time, but it really does need that sort of repeat treatment to max it out, shall we say. Now, the results, as with a lot of things we do, they take some time to come to fruition, because whatever method we use to stimulate new collagen, we can't make your skin cells make it any quicker than they want to. And a rough sort of guideline is about 12 weeks for new collagen to be made. A lot of research is suggesting it actually continues a lot longer than that, isn't it, Ali?
Mm-hmm.
So we say that
certain manufacturers will say, oh, from 8 weeks you can see it, but I think when you're looking at the actual on your skin, 12 weeks onwards, really.
Yeah, I agree. I've seen other companies that may or may not be Chorphia
shaped.
Sounds something like that. Even suggest 1 or 2 weeks after. Nay.
Nay.
What you will notice, so in terms of downtime of this, you can see Ali is really pink.
Am I? I can't feel it at all.
Yeah.
Downtime was just the next question from Helen.
Perfect. So you will be pink after
I'm
this
back
treatment.
to work this afternoon, so it'll have gone down within a couple of hours.
Yeah, if you're not looking a little bit pink, then it's not really, we're not getting the design. We want to see some inflammation to show that it's doing what it's. But this is actually very short-lived. I think because it seals off those little blood vessels on the way down, although you're pink, it's not for very long. So you could go back to work the next day and it'll be fine. What you will notice, which I don't think we can see yet on Ali.
Lisa, I think she's just about to answer your question. Will it leave tiny scabs for a while, or will...
Who's asking this? They've had the treatment clearly.
Scabs.
So what
Will you be good to show yourself in public straight after?
I mean, I wouldn't suggest
Not
doing the weekly shop immediately after, unless you want someone to ask if you've
Are you all right?
been in a sauna or something.
I mean, I probably would, because I don't give a
I
stuff.
don't care either. But yes, you will be left with teeny tiny, and I mean teeny tiny because it's literally the size of the end of these needles, micro crusts we call them, which sounds like a really nice dinner that I might have.
Oh,
Just
no!
tiny little brown dots.
Yeah.
Tiny round dots, which you can't see yet, but they are in a little bit. There is a little bit of a grid mark to them because this is dinner. So and you can't see them so much as you can feel them. So unless someone's stroking your face, they're not going to know.
It is Valentine's Day after all.
Makeup on next day?
Yeah, makeup the day after. Obviously, we are making little holes in your skin doing this treatment. So we absolutely don't want you to put anything on your skin for at least sort of 6 hours is the minimum after this treatment.
Mm-hmm.
Anything your skin will need out for you in the treatment, and then you just need to leave it well alone. But the following day, those little holes of sealed over, closed over, so makeup is fine, and you can carry on mostly your normal skin regime.
I've got 2 questions.
Oh, go for it.
So one, when you're talking about older skin, what about darker skin? Because they're often quite difficult to treat because of pigmentation problems.
Yes. So this is not a light. We just have to change a few things. So when you have a darker pigmentation changes, either lightening or darkening, but it's actually the heat from the radiofrequency that can cause that. So can't really show you that well, but rather than the heat travelling all the way down the needle, we have different needle tips where it only heats at the very, very base of the needle. So I'm not describing this very at the point, at the tip.
Point of delivery.
Yeah, right at the tip.
It's not heating the tissues on the way through.
Thanks. So it basically gives you a great result without the risk.
Mm-hmm.
So this is definitely something a darker skin type could have. Obviously, it would be decided on consultation.
Yeah.
Dark or light skin type, who it's going to be most appropriate for.
Also, I've heard.
Ali show.
Of course.
It's so hot with
that
this
it's
mask on. Talking
really
of the
good
mask,
for
not the one.
acne scarring.
Oh yeah, I forgot that.
So what
earlier.
about if you've got like, can you have it if you've got...
No, so acne scarring.
Which was one of the questions I had. Thank you very much.
Yeah, it's fantastic for acne
Good
scarring.
job, I'm here.
I
Because
know.
what it's doing is it's acne scarring is still technically a type of collagen. It's just not a good one. I know I can't breathe.
You
I'm
could
so
take that off.
hot.
I mean, we're all like
Oh.
basically family here, so.
It's one thing treating with this one, but talking. I'm roasting. Scarring. It's a type of collagen, but it's not the good type. So instead of your collagen fibres being all nice and stacked neatly in a bundle, they're all knotted together in a really messy way, which is what creates that uneven surface. So what this is great for, not only creating an injury to stimulate the right type of collagen, but it's also breaking down and splitting apart the knotted, uneven texture. So it's a really great treatment for acne scarring, or in fact any kind of scarring and stretch marks.
Actually, is it on issue? I've got another question.
The better one on the stretch mark, before she's taking it. The newer the stretch mark, the better the result you'll get.
Yes.
And scar, but not brand new.
Not brand new,
Because
but...
it need to heal. Yes.
So you're saying like 4 to 6 treatments.
Yes.
How close together?
That's a good
Oh,
question.
good question.
About 4 weeks, I would say,
Okay.
is a good spacing.
And then how long is that going to last once I've
Oh, not that question.
booted my collagen up the bottom? You know, we
I
always get asked
hate that
it.
question. How long is it going to last? How long's a piece of string?
Depends how long you cut it.
We are obviously upping your collagen levels, but they're not magically going to maintain themselves. So you will need maintenance of anything we do, much as the same way I give the name. If you go to the gym and you work out and you get in shape and you stop going, you're not going to keep that physique. The skin is no
Good
different.
analogy.
Thank you.
I like it.
I know, I've been twice and I still don't have a six-pack. I'm livid.
I've heard of them. Does that count?
A six-pack of beer, gin. So, what was the question?
So,
you need some maintenance,
a
basically.
year?
I mean, it very much depends on what your starting point is and what you're trying to achieve. So some people could have their course of 4 to 6 and then maybe just have a couple sort of throughout the year. But there are other people that will need more than that. So it's
Lifestyle
individual.
factors and stuff as well.
Lifestyle,
isn't it?
yeah. If you're smoking out in the sun 24/7,
Yeah.
that's also relevant
Bottle of
actually.
wine a night.
A bit on the beano. Don't know why we like that.
Some ciggies.
Why not? Yeah.
Danny Dyer.
Cool blimey.
Apples and
The
pears.
market.
Trying to cop these for some reason. Just because you're having a glass of
I know,
wine.
that snowballed a lot.
I know what, I think it's
That snowballed a lot. Heat stroke.
Right, now, other questions. What have we not covered?
Right.
Pigmentation. So who is this not appropriate for? Thank you, Nathan, for asking.
Who's it not appropriate for, Jade?
The usual.
Have I got panda
At
eyes?
the daff. I'm getting to under your eyes in a minute, but...
No, I thought, have I got panda eyes?
No,
Okay.
well, not too bad.
Oh, I have.
So you can't have it done if you're pregnant or breastfeeding. That's
Oh,
just a
that's
universal.
me out.
But that, I just heard
I
that.
bloody hope not.
But the answer to that is just have dogs, right?
Yeah, exactly.
Yeah.
That's
And
better.
then we'll hear this. You can
Yeah.
have this treatment all year round if you've got dogs.
Yeah.
Let me just turn this down so I can do your nose.
Talking of nose,
Yes.
Babs has just put, can I have this on my scarred nose?
Yes, you can. You can
There
have
you
it
go.
on any scarring in theory.
She's having her nose done now. What good timing.
Oh, don't go too close. I've got paws.
You've got no bats in the cave, though. It's
Thank
right,
you.
I
I
checked.
know. You had to check before
I
we
checked.
went live.
I always think that
I
at the
didn't know
dentist.
it's in your job
I
description.
know.
I just thought about it. So
I wrote that in the small print.
I went,
Yeah.
Nathan, quick, can you check if I've got bats in the cage? And then I just thought, I've just done in the cage. Bats in the cage.
Catch in the cage. Oh, well, you've got metal up there, so it works.
Come on, thank you. Sorry. So yeah, you can have it on scarring anywhere. Oh, that was a question. I haven't finished answering who cannot have it.
Who
so-
cannot have it? Do that.
Thank
Rewind.
you.
Out the duff,
Yeah, out the duff. Yeah, some medications, although there's not many, things your skin like steroids. But I actually have treated people on blood thinners with this, with obviously the possible risk of bruising and a bit more bleeding. As you can see actually on that note, this is not a particularly bleedy treatment. So although it's more invasive than standard microneedling, again, because of the heat from the needling, it sort of seals off any blood vessels. So other than a tiny bit that you can see here or there, and I'm talking tiny, it's not a treatment that involves bleeding or blood loss.
Which is good.
And actually when you Google something
Oh,
like this,
yeah, I was just about to
sometimes
say.
Oh, it's like the
mask-
Kardashians.
The vampire
Oh,
facial,
not
whatever it's called.
necessary.
it doesn't mean that we're not getting deep enough or we're not going to get great results. It's just not hygiene risk, contamination to give it. Who cannot? So I don't normally do this, but obviously disinfected afterwards. I have a really itchy nose, and I just use that to scratch it.
As you do.
As you do.
Oh my God.
Look, hygiene first. Everything will be
Jo,
absolutely...
love you guys and your treatments. I'm definitely going to come down for treatments one day. Oh, that's cute. Come on down, Jo.
Yeah, so who else can have... This is not really suitable for someone that has... Well, it's definitely not suitable for someone that has melasma, but also just is prone to pigmentation because it can make it worse. So if you have lots of pigmentation...
Don't cry, it's all right.
This is not going to be the best option for you. Laser would be much better.
Yeah.
And other than that, who else can
Which,
have it?
if you didn't see last week, it's on, where is it on? YouTube.
Oh, on our YouTube, on our website.
Yes.
So I think a lot of you have been using the anonymous questions, which is really cool. So someone put, I'm scared of needles. Well, you've seen the needles, so hopefully you're not scared now that you've seen the needles on here.
Yeah, so they're absolutely
because they are
tiny.
so tiny, you don't really see them.
You don't see them.
It's not like when Ali comes at you with a visible needle.
Yeah.
Shut up.
This is quite hidden. So yeah, it's the vacuum side of things is nice because it means a nice even treatment. When you're using something like a derma roller, you can change your pressure doing that. So you know you might not get quite as good a result one side to the other. It's a bit cack-handed.
Yeah.
This takes out any human error. Not that I do, because I am. Okay.
But also very.
Well, that's my middle name.
So I got another question that came in overnight,
Yeah.
and it was: is it just the face that this can be used on?
No, you can use this, well, head to toe really. I don't know why you would use it on your toes, but you could.
You could.
Anywhere that you want collagen stimulation or a little bit of tightening. So I use it quite often when I'm doing post-pregnancy tummies, or if someone's had a significant weight loss. It's quite good for tightening things up. It's not something I tend to use on its own when I'm doing body areas. We quite often use it in conjunction with HIFU or Skin Tight or Aqualix. So it's something that we use together with another approach.
Yeah.
Jeez, why use 5 words when you can use 5,000?
Yeah, well. I think we've answered.
You're still with us by this point. Congratulations.
Yeah,
Ali, look up for me.
we've answered all the ones.
So what else would people ask? Mostly is does it hurt? And I would say with this, with our old numbing cream, I hated having this done.
Yeah.
I love the results, but I really did not look forward to the treatment. This numbing cream, it's just much more manageable. And Ali's not that good an actor. I think if she was feeling it, she would probably.
Yeah.
I'm not. I'm a big wuss, to be fair. But this is.
So it's very manageable. I would encourage anybody, if they're looking to have something like this done, to really just go all in and have full face, because there's not a single area of skin that wouldn't benefit from it, and you'll just get an overall better result. Cost wise, the prices guide is on the website, but because we want you to have full face because you'll get a better result, it's more cost effective to do it that way as well. So but you're looking at about $395 for the full face. We do a half face option, so really
That's per treatment.
that is per treatment. If it is just, you know, literally lower face kind of region that bugs you, then there's options, put it that way.
For smaller areas.
Yeah. But I think that's it really.
Yeah, I think that's everything.
So you can see that she's nice and pink and blotchy now, but we'll take a picture again later maybe and put it on the story so that you can see that it's settled quite quickly. And I don't think her little grid marks are going to show up anytime soon. Sometimes they're not visible till sort of the next day. Well, sometimes you can barely see them at all, quite honestly.
Oh my God, he's so
was
close.
retinol.
Oh yeah, retinol.
And someone asked about retinol,
They
which
did.
is a great question. With most treatments like this, we ask you to stop it a good sort of 3 days plus in advance, and don't restart it until everything's healed, basically. So those little brown dots I mentioned usually take up to a week to kind of just gently flake away. So you're looking at around about a week before you reintroduce retinol.
Lovely.
Thank you very much.
That's it. Well done.
Yeah, well done.
Let me clean you up.
Ta-da.
Clean me up. Bit of blood in it.
Oh.
Right. Just a little bit.
Just a little bit. Right, we'll end it there then, guys.
Okay, thank you. Any other questions if you're watching us back later? Stick it in the comments.
And
you know the
we'll
drill.
respond to you later.
Yeah, sure.
Thank you for joining
Happy
in.
Valentine's. I'm going to go and stand in the garden now.
Yeah.
Cool off.
Happy
This is
Valentine's,
menopause.
everyone. Oh,
No.
no, it's just
Yes, happy Valentine's.
just the heating.
Everybody
I'm not doing that.
do a love heart, Mum. Come on.
Oh,
Quick.
drop the phone. Oh, you're doing binoculars.
Oh.
Who's doing
Oh,
the
no, I
binoculars?
look like I'm on tag out
What?
of license.
Yeah, she
How
does.
did your leg come into this?
Because I've got a
She's got love hearts on there. So
Valentine's Day.
cute. Right. On that note,
Right,
bye
love you,
everyone.
bye.
Bye.